series with ACE, and we're really happy to welcome Dr. Sharrelle Barber from Drexel University. So if you want to go ahead and introduce yourself and get into it.
Sure. Thank you so much. And I just want to say thank you again for the invitation. As I told you all earlier, I'm really impressed by the work that you all are doing in terms of holding these sessions for, advancing understanding of these issues. So really, really just grateful for you for the invitation. And I mean, I'm really impressed. But again, my name is Dr. Sharrelle Barber. I'm a social epidemiologist. And what that means is that I, really have done work in research and teaching that tries to understand how the broader social, economic, political context shapes health, right? And really shapes health inequities. And so I have work that is based in Philadelphia, where I live and teach. I also have work and research that's based in Jackson, Mississippi, which is where I've been doing a lot of my work. And then I also have work internationally in Brazil. Because we, see some of these same issues play out in that context as well. And I describe my work at the intersection of race, place, and health, and really thinking about how structural racism, literally, I've been saying, really, literally, quite literally, is embedded in the brick and mortar of every city that we have in this country, as well as the social fabric of cities. And so I'm going to show you some work and talk about how I've been thinking about, and myself and my colleagues have been thinking about how the pandemic has really kind of shed light on a lot of those issues. And so I'm going to start sharing my screen here. So I'm just going to do a talk entitled Racism in the Time of COVID-19, Reflections on Racism and Resistance in the Pandemic and Beyond. And so, all of us have been in this COVID-19 pandemic for over a year. This is a picture from earlier this month when, actually it was late last month, early this month. The time is a blur, but it was when President Biden and Vice President Harris really marked where here in the United States, we got to over 500,000 deaths. And as a social epidemiologist, and just as an epidemiologist in general, part of my job description has been to track and count these cases and count these deaths. So it's very sobering to think about us getting to 500,000 people dying within the span of 1 year. And what I've tried to remind myself, and just kind of anytime we're talking about COVID, is that, we in epidemiology, we see this as data, but these are people, these are humans, these are moms and dads and grandmoms. These are some kids who fall into COVID. These are folks who are anchors in their community, right? And so I think that it is important that even as we are super excited about trying to get on the other side of the pandemic with the vaccine, that we don't lose sight of the loss that we've had. And I think our shared humanity really requires that we sit with that and actually question what got us here. How as a country did we get here? And, many public health scholars have argued that much of the death and devastation that we have seen could have been avoided had we taken the proper precautions up front initially. And we actually see examples of countries where the death toll on the cases have been much less than what we see in the United States. And so again, public health leaders, major academic journals really called out the prior or previous administration for their recklessness in this pandemic. And that really feeding into what we've seen, not only with the overall toll of the pandemic, but also with the inequities that we have seen. And so again, it's really important that we kind of situate our understanding of the pandemic there. And unfortunately this year, as devastating as the pandemic alone has been, we've also had to grapple and wrestle with these instances of what I call state-sanctioned violence. This is, I'm reminded this month in particular of the murder of Breonna Taylor. She was a 26-year-old emergency room technician who was an essential worker, daily, kind of gave her life and risked her life at the early onset of the pandemic, and then was gunned down in her home, due to an outdated no-knock warrant, right? And so Again, having to wrestle with her murder and Ahmaud Arbery and George Floyd and countless others. And even just a week or so ago, having to deal with the violence inflicted against Asian Americans here in the United States. And my argument is this, that the deaths due to COVID and the deaths due to this kind of state-sanctioned violence are actually linked. And they all come from the same root of racism, of white supremacy in this country. And we have to understand them as interlocking systems of oppression, right? And so, and how they get embedded in individuals in the form of biases and prejudice and racism that plays out in violence, but how they also get embedded in our systems and our structures. And so a piece that I wrote, this was actually released back in August of 2020, was called Death by Racism. Again, linking the deaths of folks like George Floyd, the murders really, to the Black lives in particular, but also other racial groups that we've seen play out in the pandemic. And then this is data, actually, this is older data because the pandemic is always changing. But like I said, this has played out in the racial inequities that we've seen. So these are data from February that show that for Black, Indigenous, Latino, and Pacific Islanders, the rates of death have been 2 times that of whites, right? And so this data, and this has shifted over time. In particular, there was one point where Black and Indigenous individuals were seeing the higher rates or higher disparities, but we're now seeing that, you know, for the most part, there's about a 2-fold difference in the death, you know, across racial groups. Again, not by accident, not because of some innate biological genetic differences, not just because of behavioral differences, because there's across all racial groups, people are either not wearing masks or other things, but there are these deeply rooted structural issues that we have to understand in order to really think about why we're seeing this. And so last year, a group of colleagues and myself, it was 6 of us, before data even became available on race, widespread, we decided that we wanted to help to shape the narrative because we knew that although this was being deemed a great equalizer, that racial inequities were inevitable, both because of what we see in other health outcomes, but because of these deep-rooted issues. And so we said that while COVID-19 is indiscriminate in its transmission, its propagation within a society steeped in structural racism will undoubtedly, as we're already beginning to see, lead to disproportionate impacts among marginalized racial groups in this country. We said that, we were saying this before the data came out, and then lo and behold, late March into early April, we started seeing the emergence of data, first in places like Michigan, also I think Wisconsin was some of the first places that showed data by race. And we began to see this uptick and the inequities, both in the cases as well as the deaths, really show up with this pandemic within a matter of months. So, and we're dealing with it, and we have been dealing with it for the last year. And so I think it's important that we understand, and when we think about health, and we often think about quote unquote pre-existing conditions. And what I say is that racism is our country's underlying pre-existing condition. If you go back, for example, to 1619, which was a little over 400 years ago, and track the time for slavery, and then Jim Crow and segregation, we've only been quote unquote free for 55 years in this country, which is only about 14% of our time here, right? So if you look at that, if you think about that, put that in context, what was all the damage that has been done in that other part of the time? And still, there's still damage being done, right? And there's still laws and policies that are damaging our Black folks in particular. We also have to understand this in the context of the dispossession of Indigenous folks, right? And so the pillars upon which this country were built was the enslavement of West and Central Africans and the dispossession and the expulsion, the violent expulsion of Indigenous peoples from their land. And it's upon those 2 pillars that this country was built. And if we don't understand and grapple with that, then we can't move forward in a way that is truthful and more equitable and more just. And so I've been saying this word racism, right? But I like to give definitions because I think it's important for us to say, well, like, what do you mean by racism, right? Like, because everybody's been talking about it. especially with what we've seen over the year. And I like a definition that Dr. Kamar Jones, who's also an epidemiologist, she uses, because it gets us away from just this like personal interactions with people to really the things, the systems. And she calls it a system of structuring opportunity and assigning value based on the social interpretation of how one looks. That's what we call race. And the reason she says it's the social interpretation, because race is a social construct. It was literally made up to kind of uphold this system of white supremacy. So you have this race, these racial categories that we made up. And then in this country, we have literally structured opportunities based on that racial classification. And so it does three things. It unfairly disadvantages individuals and communities, and we talk about that a lot. We also have to talk about the fact that it unfairly advantages some individuals and communities. And then I like this last one. She talks about how it saps the strength of the whole society through the waste of human resources. So the fact that racism exists is not just bad for Blacks or bad for Indigenous folks or bad for certain racial groups, it's bad for everybody, right? And so and this pandemic has really shown that, because the pandemic doesn't care if you're Black or it's just going to be. So the fact that we, have these inequities, we're only as safe as the most marginalized, meaning we have to pay attention to everybody. Otherwise, we're all, going to continue to be in this. And this pandemic, again, has shown that we are only as strong as those who, we've kind of pushed to the margins. So we need to get rid of the margins, in my opinion, right? Because it's actually doing us harm, all of us harm in this country. And so Nikki Giovanni, who's one of my favorite poets, she says it like this: if now isn't a good time for truth, I don't see when we'll get to it. And so this pandemic has just really exposed what many of us already knew, but what we have to, again, grapple with if we're going to, one, understand what we're dealing with now and think about how we want to move forward. So this is what I call and kind of embodied racism. And it's a phrase that kind of literally says, how do we biologically incorporate these broader systems and structures? And Ta-Nehisi Coates, in his book, Between the World and Me, does a really powerful, poignant job describing embodiment. He says, but all our phrasing, race relations, racial chasm, racial justice, racial profiling, white privilege, even white supremacy, serves to obscure that racism is a visceral experience, that it dislodges brains, blocks airways, rips muscle, extracts organs, cracks bones, breaks teeth. You must never look away from this. You must always remember that the sociology, the history, the economics, the graphs, the charts, the regressions all land with great violence upon the body. And that's what we've seen in this pandemic, that literally racism and capitalism and other isms have become embodied. And we've seen these devastating impacts in our most marginalized racial groups. So I'm going to turn now to some research that I've done, and I'm being mindful of time, so just in case folks want to ask questions. So, early on in the pandemic, again, we were seeing these racial inequities emerge all over the country. And in Philadelphia, we also had we were fortunate to have some data that was also delineated not only by race, but by zip code. And so what we wanted to do is show how this was playing out in different zip codes in Philadelphia. And so I have a bunch of collaborators who've been phenomenal on this work and have been really helping me to put this together. And so this is what we saw like between March and May of 2020 in terms of Blacks being more likely to have COVID-19 across all the age groups in Philadelphia. And we said that our understanding of this had to be rooted in an understanding of racial residential segregation. I'm not sure how many of you are familiar with the practice of redlining, but this book, The Color of Law, and a complimentary 17-minute documentary called Segregated by Design is actually a great resource if you're interested in these issues. But again, when I say racism is literally embedded in the brick and mortar, this is what I mean. So in the 1930s, the federal government produced maps for just about every major metropolitan area in the country, and to say where different investments would go. And the red line areas were literally places where Black folks lived and or they were industrial places, et cetera. But it was basically, we're giving a signal to mortgage companies and banks to say, don't invest or don't give loans in these areas. This laid the groundwork for the contemporary segregation that we see to this day. So a policy way back in the 1930s has been so enduring in this country that has led to deeply seated, separate and unequal residential environments that has not been by accident, but by design. We also know that this racial residential segregation has been upheld by a lot of violence. So this is the picture that you see on the right-hand side is a picture of a mob of about 4,000 white individuals who literally stormed the home of a Black couple who were trying to move into Cicero, Illinois, right outside of Chicago. They were a working class family, wanted to move to better residential and housing conditions. But again, whites in that community did not want them there and literally burned their things on the front of the lawn, all while police officers were standing there. So again, we have enforced and reinforced these policies, oftentimes with violence. And in 1968, we did sign, or the federal government did sign the Federal Fair Housing Act, 1968, April 11th, 1968, which was actually 1 week after the assassination of Martin Luther King Jr. So they were able to push this legislation through because of the assassination of Martin Luther King. Again, we have to understand that a lot of the progress, unfortunately, in this country has been literally paid for in blood. Like literally, that was the reason they were able to push the Fair Housing Act, which said that discrimination based on race and other dimensions was actually illegal. Unfortunately, with policies and with the way racism operates, it usually shapeshifts. So you have this 1968 policy that does away with housing discrimination. However, even 50 plus years later, we still have very separate, very unequal residential environments, again, propagated by different both public policies, but also private actors are playing into why we still see to this day separate and unequal conditions. And then this is a map on the left-hand side of Philadelphia, the red line map of Philadelphia. And then on the right-hand side is current levels of what we call social vulnerability. These maps are really highly correlated such that red line areas in the 1930s still are some of the most disinvested and socially vulnerable communities in Philadelphia. And this plays out across the country. Like I said, there's a legacy of also environmental racism. This picture is a picture of one of the largest oil refineries that was just shut down in Philadelphia about 2 years ago. And it was placed in a red line area in the 1930s. And then in the 1940s and 50s, when decisions were being made about public housing, decision makers decided, oh, well, it's okay to put Black, poor, public housing for public housing options for Black poor folks in this red line area that is, again, right next door to a major pollutant. And in the same area, you have high levels of cancer, asthma, and other chronic diseases. Again, these things are not by accident, but by design. And we have to acknowledge that if we're going to move forward. We've also in this time period been talking a lot about mass incarceration and police brutality and violence. And what I remind people is that segregation is also tied to this, such that we have literally waged war in this country against Black poor communities mostly. And this is one of the reasons Breonna Taylor was killed, was because of this, quote unquote, a suspicion of drugs, right? But this war has literally cost us millions, even billions of dollars over the last several decades. And those billions of dollars, instead of being invested in housing, in health, and in other things that would actually be conducive to for communities to thrive, they've been invested in police departments where, again, many of these communities have been targeted violently and otherwise. And so you have a level of racial trauma in these areas, and literal extraction of individuals, resources, et cetera, that leads again to these unhealthy conditions. I showed this picture. This was a picture from Philadelphia, right during the protests after George Floyd was murdered. And it just was so shocking to me how we could literally in Philadelphia deploy the National Guard and police officers within days, but it took us months to get the kinds of resources to Black communities to combat the pandemic. But it only took us a matter of days to get, police officers in those same communities. So again, it shows us where our value systems are. It shows us what communities we value and what communities we don't. And literally is another demonstration of how, we just devalue certain lives in this country. So just to speed up, we kind of created these maps of Philadelphia, and we showed again where we have the redlining map on the left-hand side. We then looked at current day segregation and susceptibility to COVID-19. And there were two areas in our city, in North Philadelphia, what we call North Philadelphia, as well as in West Philadelphia, where the line or the kind of correlation between being formerly redlined, current days levels of segregation, and structural susceptibility to COVID-19 overlapped. And in some of those same zip codes we see, which are 19132 and 19139 in Philadelphia, those were some of the places with some of the highest cases of COVID early on. This was between March and May. And these rates were actually 23% higher than the city overall. And then if you compare the most segregated zip codes with the least segregated zip codes, the rates were 2 times in those neighborhoods. Again, just demonstrating with data how this was playing out in real time in Philadelphia. We recently updated this data to look at both cases and deaths, and we see some similar patterns. Again, higher cases and also higher deaths through January 2021. So again, COVID-19 for us, again, shows how these inequities are embedded. But again, we contextualize it and put it in the context of racism and segregation so we could understand what the structural drivers were. Let's see, I'm at 527. So one of the things that we followed up the empirical work, the maps and the data, we also wanted to hear from the community. What were they, or how were community folks in some of these hardest hit neighborhoods and zip codes, how were they experiencing it? And one story that will stick with me throughout, my work is that a woman was telling us that her son worked at a local hospital. He is a maintenance person, was a maintenance person and is a maintenance person at a local hospital here in Philadelphia. And, but he had been tasked because of the shortages in personnel to help bag bodies. And when I thought about the fact that he had to go from fixing things and, or being, up the upkeep of the hospital to bagging bodies, I've just thought continuously about the trauma that that folks are experiencing, communities are experiencing, and the ways in which these are things that we wouldn't even know or don't even see, right? And so what does it mean for someone to have to switch as an essential worker, right? To have to switch from just being a maintenance person to bagging bodies? And have we honored our essential workers and those who have been on the front lines in the proper way by providing them with protection, by providing them with living wages? We've literally called them essential during a pandemic. However, that doesn't show up in their paycheck where it really matters, right? And so what does that say about, again, who we value, how we value people, and who we deem disposable? Also just wanted you all to recognize that this is happening here in the US, but it's also happening in other countries like Brazil. So like I said, I do work in Brazil. They're seeing similar patterns of COVID-19 devastating Black communities. They've also had some instances of state-sanctioned violence where they've had to be in the streets and protesting. So again, this is a problem. It's an issue that is not only US focused, but also has implications for other parts of the world. So I've talked a lot about the devastation of racism. I've talked a lot about what we've seen in terms of the impact, but I can't leave, and I'd never leave the conversation there, because as much as we've seen so much devastation during this pandemic, we've also seen a lot of power and people rising. I mean, literally protests around the world, the very communities who've been the most directly impacted, standing up, not only in protest, not only in kind of challenging this country to do better, but also in the ways in which they've served, each other. In Philadelphia, for example, we have what's called the Black Doctors Consortium for COVID-19, and they've literally been a coalition of Black doctors who, when testing wasn't getting to Black communities, they set up mobile testing sites. When vaccines weren't getting to Black communities, they've set up mobile vaccine sites. Again, they've stepped in where our local decision makers and folks in power have not. And that, again, I think shows the power and the resilience and the resistance, particularly of those who've been most impacted by racism. And that is a legacy that is as much as 1619 is a legacy, there's always been a legacy of resistance, of activism against these systems of oppression, of pushing us as a country to be better so that all communities can be healthy, all communities can thrive. And that is what I think that's the hope, the silver lining in this moment. Against the backdrop of all this devastation and death, we've also seen a tremendous amount of power. And that's what I think is necessary and important for moving us forward. So in that piece, racism in the time of COVID-19 that I wrote with my colleagues about a year ago, we said, this is our final quote. We said, finally, as a field with a mandate to ensure the public's health, efforts to mitigate the effects of this pandemic must work in tandem with our ongoing commitment to dismantling the structural and institutional drivers of health inequity that existed before the crisis. We have an ethical and moral responsibility to harness our collective strength, speak truth to power, and demand that racial equity and social justice be central to our response to this pandemic and beyond. The stakes are too high to sit on the sidelines. This is a matter of life and death, and we must all act accordingly. And as a public health scholar, as a social epidemiologist, I am more committed to this work now, and hope to be a part of the collective of folks who work towards justice, work toward equity beyond the pandemic. And so thank you so much for your time, and I'll take questions.
Okay, so everyone that's here, think of your questions while I ask my question to Dr. Barber so we can keep it going. But basically my question to you was, it's so ingrained in our policy and all the laws that we've enacted, and you touched a little bit about how poorly the previous administration handled this. So I was just kind of wondering what you'd like to see, or what you hope to see policy wise moving forward to help combat this.
Absolutely. So, one of the things I will say that we did collectively in public health, breathe a sigh of relief with this the new election. Literally, it's okay, at least people who listen to science, listen to scientists, look at the data will be in charge. And what I do see, and with this current administration, is that they hit the ground running. They put together a whole task force that is committed to equity and justice. And I am seeing some of the fruits of that labor. So for example, this new Recovery Act that was put forth went a much further way, much longer way in terms of getting some relief to people who've needed it. Again, food insecurity and housing insecurity and all those issues have skyrocketed. And I will say that it's still not enough for the depth of the economic crisis that folks are in, but it's a lot more than what folks had. And so I think there's going to be some relief there. They have a commitment to vaccine equity, which is important. Again, it's how does that get played out on the ground, and making sure we hold local and state level folks accountable, because they're the ones who are actually carrying it out. I appreciate the commitment to data, using data. The CDC now does regular updates, which they should have been doing all along, but they're doing these regular updates that at least help us to understand where we are in the pandemic and those kinds of things. And again, I do think that there is a commitment to justice. A frustrating thing, though, I will say, is that, we still didn't get $15 for workers, in this last legislation. And I'm just like, oh my God, well, after all we've seen with workers, and we're like, oh, they're our heroes, and patting them on the back and giving them pins. They're like, no, give them a livable wage. And I am part of my work as a scholar. I've been working alongside some activist organizations during the pandemic and hearing their stories. And we've got to get that right. We've got to give people a living wage. We've got to give people access to healthcare. Everybody, no questions asked, you have access to healthcare, because we don't have that right now. We need to make sure that we address the looming, or actually kind of already here, crisis of climate, right? Because if we don't take the lessons from this pandemic into what we need to do to prepare for the climate crisis, we're going to see these same racial, economic inequities play out. And so how do we preempt some of that by taking the lessons and putting in the kinds of policies that will help that communities to be resilient, but also, again, building, a green economy and things like that. So I think that bold legislation is necessary, that values and honors everyone as humans, that, our shared humanity and dignity, right? And that's what I want to see. And it has to happen federal, state, and local level, because sometimes stuff will happen at the federal level, but it doesn't trickle down to the local level. So it's got to be all hands on deck and at multiple levels. Otherwise, we're going to regress and we're not going to take any of the lessons forward.
I have a question. Do you think that on a local level, the reason that other communities aren't taking the steps, like in Philadelphia, you said with the mobile vaccines and the mobile testing, do you think that it's because of just being uninformed, or do you think that people are just ignoring the statistics?
I mean, I think that people, one of the things that I think that has been, and we heard it from communities, those who are decision makers, like at the departments of public health or local governments, just haven't planned for equity or justice, right? So it's one thing to say, oh, these exist, because I think they see the data. They actually are the curators of the data, so they have it. But they have not put in the work to do the planning necessary to actually make equity a reality on the ground. They've not done, I don't think, and I know this again from conversations I've had with people on the ground, they haven't talked with community folks. One of the things about what we have to do, because our public health infrastructure has been so eroded over the last several decades, we've got to fill in the holes during this crisis. So the way you do that, particularly among marginalized groups, is work with communities, work with the community organizations, with churches, with trusted individuals in the communities to fill those gaps. And they've just not done a good job of that outreach. We had a whole scandal here early on where the Department of Public Health gave a contract to a young 20-something-year-old who had no background in healthcare, just wanted, it was a debacle. And then you have Black doctors where they weren't giving those same resources to, right? And the Black doctor, the woman who's over it, her name is Ala Stanford. She's a 42-year-old pediatric surgeon who's been doing work since before these people were born, but they didn't give her the contract to help to think about how to do vaccine equity. And she had already been doing testing for about 9 months in the pandemic. So you see, so there's these decisions that you're like, okay, you say you want to deal with equity, but when you have an opportunity to actually have that play out, you don't do it. So your words don't match your actions. And that's what's happened. A lot of people will maybe say that there are inequities, but they don't do the hard work of actually addressing. Because what you have to do in this pandemic is literally redress the 400 years plus of inequities and say, okay, how are we going to fill the gaps in this moment? And then how do we think about how we build a better system moving forward? And yeah, we just haven't done a good job of that. Other questions?
Yeah, I have a question similar to what Catalina asked. So I'm thinking a lot about how you mentioned how there was really not that much testing, these Black communities and how those Black doctors that came together. And then also what Catalina said, how it's all ingrained, these systems of oppression work together. So my question is like, in terms of like dismantling systems of oppression,
Mhm.
how optimistic are you that it will come from things like electoralism and like getting like better administrations in office rather than like community organizing? And
So I,
also like, yeah, go
Mhm.
ahead.
No. I think it has to be a both man. Like we need all of it. So we have to understand the different ways in which the apparatus of white supremacy operates. It operates through who's in power, right? So power is important. So literally having the administration, I don't even like to call his name, but that administration was deadly for all of us, right? And so we need to have elected officials, but that's one step. That's one step because we know that at least we have an administration, while not perfect, we can talk to, we can at least say, this is what we need and get a little bit further along, right? So you have to have electoral politics, federal, state, and local, because some people, we always focus on the federal, we don't really focus on the local. So we need all hands on deck, because what we're seeing in Georgia, for example, is it's the state legislature that's putting together all these voter suppression bills and that they're coming out, right? So we've got to have that. So there is power in voting. And then there also has to be the organizing and understanding how these, again, an understanding of how these systems and structures came to be, what are the policy remedies for that, and how federal, state, and local kind of interact. So we also have to understand how what happens at the federal level interacts with what happens locally and at the state level. There's so many nuances, but we have to get a handle on that, right, in order to do important work. The final thing is not just policymakers, but also private actors. So we cannot, dismiss the massive role that corporations and other entities have in these communities, right? And so how do we understand how the private sector also contributes and upholds these systems and structures? So, because I said, Federal Housing Act of 1968, over 50 years ago, federally, technically, discrimination is illegal, but it has found a way within the mortgage system to reinvent itself. And again, those are also actors and players that we have to pay attention to and figure out how to regulate so that we can dismantle.
Thank you.
Yep.
And kind of along with that, just like a follow-up, like besides private actors and policymakers, like what can individuals like us do to like help dismantle that?
Yeah, I mean, I think what you all are doing, and not to I really mean this, like the deep understanding of these issues, because again, we've not on a mass scale been taught these things about how our systems have come to be. Literally, we think, oh, that's just how it's been. And so, this forum, this space that you all have created to say, how did we get here? What were the decisions, both at multiple levels to get here, so that we can begin to say, well, how do we begin to think about dismantling or putting forth policies that would undo some of these things. So for example, and so your role is as citizen, right? We are all in this together. So your role is, how can you get a little bit more engaged in your local community, in politics, and organizations who've been doing this work and aligning yourself with those organizations, becoming allies and partners with those. But again, the stakes aren't just, it's not just about those most marginalized, it's all of us. And so what do we do in order to educate ourselves about these issues, advocate for the kinds of policies that are necessary, vote the kind people that are aligned with those kinds of policies? All those kinds of things are important. And then the final thing I'll say is, find your thing, because it's a lot. There's a lot to do, but there's work for everybody. So I'll say is, I grew up, when I was in high school, I had always envisioned going to medical school. Could have, it had a 4.0 in college and stuff, but public health found me and I got so excited about it. So my passion has been in public health, and I use the lens of public health to do the work in my research and my teaching, et cetera. So the other thing is finding that thing you're passionate about, committing to it, and figuring out how that fits into the broader movement and social justice that we need. So you can be an engineer and find a way to do, how do we rebuild our cities to be more equitable? You can be a computer scientist, because with all this AI stuff coming out, we got to make sure that we don't embed the same racism into AI that we have, in our society. So you can find your thing that you do and do it from a lens of social justice, of equity, and that will go a long way as well.
Thank you so much for answering our questions. I have just like a final little follow-up to that, and then I'll kind of wrap up and ask. But so in terms of self-education, because, you know, once you're young and when you're figuring out your passion, you're also learning a lot. And like you said, it's not really taught to us. So what kind of resources or novels or even websites to check regularly would you recommend for people our age?
Yeah, so what I'll say is it's a lifelong process. I went to the bookstore today and picked up like 6 books just because it's an ongoing process. And I think the commitment to learning and being humble is important. So again, just because I have a degree and some professor and, you know, I'm a professor, I'm still learning. But some of the books that I would recommend, so that book I showed you, The Color of Law, actually is one of the foundational books in the course that I teach on urban inequality and health, just because it lays out in a very clear way, I think, how we got to where we did in terms of segregation. But then there's the 17-minute like documentary that they put together that's really it actually goes really quickly, but it does a really good deep dive, and it's called Segregated by Design, and that's open on the web. You can find that. Some of the work by Ibram Kendi, but not just his How to Be an Anti-Racist. He had some books prior to that called Stamped from the Beginning that are really powerful, even more of a deep dive into some of the issues he raises in the How to Be an Anti-Racist that I think are important. What are some other resources? I can also just send some links and things, but the Movement for Black Lives, has resources and different things that are can be, relevant. The New Jim Crow that I sent to you, Michelle Alexander, I shared, you saw that. There's so much, there's so much reading to do. But yeah, I think those are some places to start. There's this new book that I actually just picked up, A Black Woman's History of the United States. So what has it been to think about the history of the United States through the lens of Black women? I think those are also, that's also a good book that I'm looking forward to reading. And I can think some more, I'll send them for sure.
Yeah, that's perfect, because we actually have like part of our club that likes to put together like additional resources after, so a list would be great as well.
Absolutely.
Thank you so much. Yeah, so thank you so much for your time. Before we go, we would love to ask a little favor of everyone. If everyone could just turn on their camera really quickly, we're just going to take a little picture to maybe post on our social medias after to say thank you and to shout out Dr. Barber for her work today. So if we guys could turn on your camera just really quickly, like 1 minute, 1 second.
Thank you all this has been great. I really have appreciated the time to share with you all.
All right, Lily, are you gonna take it? Awesome. Everyone smile. Awesome. Okay. Thanks everyone for coming, and thank you so much, Dr. Barber, for your time today. Like, this was a really interesting discussion, and I'm sure everyone learned something. I mean, we all kind of have heard like, oh, COVID's always disproportionately affected, minorities, but what does that actually mean? That's hard for us to access that kind of information, and we really appreciate your expertise and your words and just our conversation today. So thank you so much.
Thank you so much. All right, you all have a great one. Take care.
Thanks everyone for coming. Bye.
Bye, guys.